Hello friends, Namaskar. So I'll be talking about emotional reactions and particularly collusion and how to break the collusion. In earlier lectures, we discussed about psychological reactions, and they basically, whenever a particular dreadful diagnosis has been disclosed to the patient, they start step by step. Patient, after hearing that he is suffering from such a disease, life limiting, or maybe you can say he may not survive much longer, the first thing comes under distress, lots of tension, Then immediately, unconsciously denies. It's a denial that he just knows this cannot happen to me. Why me only? I'm fit and fine. This diagnosis is wrong. Now, after denial, two things takes place. The doctor, with the help of relatives, break the denial, and they very gently pursue the patient that no, please accept this. This is really what has happened to you. This is the diagnosis. This is the scientific proof. Nothing, I mean, this is what is there. This is the reality of your life. If patient agrees with it, then the normal treatment plan, whatever doctor decides for the treatment, it goes forward. Now, sometimes what happens that such diagnosis, the relatives also, they say, no, don't tell the patient, Don't tell the patient, don't tell him that he is suffering from cancer of advanced stage, He may not be able to digest this, he might get a heart attack, he will die instantly. He is a very weak person, very weak heart. And they request the doctor, please don't tell him, So when such a thing happens, in medical terminology, we call it collusion. So collusion comes little later. Let us firstly talk about how to handle emotional reactions. Emotional reactions normally come, it's a normal process, natural process, and they occur with major loss of any kind. Major. If somebody falls sick, nothing is going to happen. Some fever or some indigestion or some diarrhea. It's not a cause of concern because everybody knows that within few days after proper treatment, you'll be fine, fit, running around, happy. Major illness, where you think that it's going to limit your happiness in the life. Major illness, amputations, in accident, you might lose a limb, maybe one hand, maybe two hands, maybe one leg. Now without hands or legs, how are you going to live the life? So far you had been running around, you had been driving scooters, bikes and cars. We were a free bird, and all of a sudden when we are without legs or without hands, you just feel the situation. Divorce. You are happily married, you are loving each other, and all of a sudden wife says or some spouse says that we can't stay together. Bereavement, somebody dies, somebody very close to you. People keep on dying here or there, but every time when somebody dies, nothing, because they are very far off. Emotionally you are not attached, but somebody very close to in your family dies, with whom you have been staying for a number of years. You are really attached. So that bereavement does put lots of grief on you. And anticipated loss of one's own life. So far we have been talking about somebody else suffering. Now when it comes to you that I am going to die, that is where psychological reactions start coming in. when psychological responses do not occur in sequence. Remember, I just spoke to you about sequence, distress and denial and collusion, but sometimes they come, it is not step by step. This is for the understanding. It may come within a minute's time, because our mind is very fast. They do not occur in sequence, but for better understanding, at least some pace is there between all these steps. Oscillations in patients' feelings are natural and common. When they occur at or shortly after diagnosis, normally, that is what happens. Fear is one of the psychological reactions. When does a person comes into fear? When he says this, when he thinks, when he sees that something very nasty is going to happen to him. His life is under threat at or shortly after diagnosis. Similarly with the patient also, when diagnosis comes and it is not a good diagnosis, at first recurrence and as death approaches. When death comes closer and closer, then slowly and slowly, once you accept the fact that I am going to die, you generally accept the fact that it's a reality, one accepts it later on. But then your thought process turns towards your family, society. What about my children? What about my wife? What about my husband? So as death approaches, you think about others, and that is where psychological reactions start coming in. Tumor is getting bigger. Psychological reactions comes, but sometimes doctors are not trained to respond psychologically. They are medical people. There is a case that a lady was suffering from a cancer tumor. Naturally, tumors start coming in. You are really worrying about it. So one day in the morning when doctor visited this lady, the lady said, doctor, you see my tumor is getting bigger. Doctor just responded very dully, yes, earlier it was 4 millimeter and now it is 6 millimeter. This is not the response the doctor has to give, and this is not the response what lady had expected. She was worrying that my tumor is getting bigger, that my disease is not now under our control, it's spreading fast. But here doctor talks about medically, yes, size and other things he is talking about. So in such a situation, when psychological reaction takes place, the first thing a doctor and the nurses, they have to align themselves with the patient and their feelings. Patient says my tumor is getting bigger. Doctor says yes, it was 4 millimeter and now it is about 6 millimeter. Reason being, physicians are trained to be medically oriented, not psychologically oriented. And here comes the communication gap. Dear friends, palliative care is the only stream, only discipline in medical science which does lots of things differently. In palliative care, first thing that we do treat disease, but along with the disease treatment, we lay bigger, heavier emphasis for the treatment of the person himself and his or her relatives. We want to treat the person, we want to treat the disease also, but at the same time we want to treat the person psychologically. Second, in palliative care, we lay lots of emphasis on communication skills, how the doctors and nurses should talk to the patient, even relatives also. 2-3 words are there. Apathy, that means you are neglecting the patient, you are not with him or her, totally neglecting. Sympathy, a step higher than sympathy is empathy. You understand the condition, psychological condition of the patient, and at the same time you experience the same feelings within yourself. That is empathy. Bigger than empathy is the compassion. And that is where you get aligned with the psychological feeling of the patient, and patient feels closure. He wants to disclose so many things. Patient thinks this doctor is my buddy, my friend, So, in communication skills, you should be very, very good with the patients. And third thing, this is the only stream, medical stream, which keeps on working even after death of the patient. We provide grief and bereavement support to the family members. Till the time patient is alive, fine, we want to treat him and we want to give psychological support, including social, financial, spiritual support. And if he dies, then we do not leave him at that place. We do not leave him after the death. We continue providing proper support to the members of the family. That we call bereavement support. So here patients often express their emotions very indirectly when they complain. This represents an opportunity for doctors to acknowledge the emotions of the patient. Emotions or feelings. Emotion is the complex psychophysiological experience of an individual state of mind as interacting with biochemical and environmental influences. It's a state of mind, what is going on inside the mind, inside the body, and what is going on outside. So, the combination of these two feelings, that is the emotion. In humans, emotion fundamentally involves physiological arousal, expressive behaviors and conscious experience. Emotions are, in a way, they are feelings only. To understand your emotions, you need to ask yourself two questions. How do I feel? And secondly, how do I know? But others also have emotions. At the same time as being aware of your feelings, you also need to be aware of those of others. You also need to ask how do others feel and how do I know. So, it is a two-way traffic. Don't think about yourself only. It is just self-oriented approach. Think about others' feelings also. Addressing emotional reactions, good communication is at the heart of better patient care, safety, satisfaction and outcomes. Patients who understand their care plan are more likely to follow treatment, modify lifestyle choices and behaviors and adhere to instructions. You will get cooperation, lots of cooperation from the patient if your communication skill is good. You will develop relationship with the patients. Communication technology supports patient and their loved ones throughout the healthcare experience by facilitating effective patient engagement before, during and after the treatment. And here I will add another word, even after death also communication will provide bereavement support and grief support to the family members, close family members of the dead patient. Dealing with difficult patients will always be a challenge for any practitioner. The following steps can be used to help ensure that various situations can be diffused and resolved appropriately. There are difficult patients, they do not understand you, they do not listen to you, they do not want to go ahead with you, they do not want to take medicines, they are so difficult and they persist for days together because emotionally they are so hurt, they think that the society has done lots of harms to them. So, with such people, how should you deal with them? First is the listen. Active listening has got lots of importance in palliative care. Otherwise, also whenever we listen to any person during normal conversation, he or she feels very happy. Yes, this man is listening to me very intently. He is interested in me. Exactly the similar way, one must listen to the patient what he's talking about, because patient is generally going to talk about his emotional state of mind. Patients and family members should be given undivided attention. Allow them to explain their concerns without interruption and listen without attributing fault. Second, empathize. I said not only sympathy, go a step further up, empathize. Reassure the patient, family member that their concerns are taken seriously, offering a statement of understanding without agreeing to fault on behalf of the practice providers or staff. Third, ask, inquire, ask him what is happening to you, what are your feelings, what are your emotions, what do you want to do further. Attempt to identify the primary and any underlying reasons of the concern. Everybody has got problems. in this world, you won't find a single person who doesn't have a worry or a problem. And therefore, people who are seriously ill, they got many problems. So it is difficult to understand the man with so many problems. It is better to talk to him very nicely, gently, and let it come out with all his problems. Let him vomit out everything in front of you. This will help determine the best course of action on how to properly handle the concern. Whatever he is feeling about, then he will try and listen to you. ACT, it's again an acronym. ACT means appear calm and tactful. Don't hurry up, don't get rushed up, and do not speak very directly. Do not give your judgment immediately. Be tactful. Appear calm and tactful. Remember to always remain calm and professional even if the situation escalates and the patient or family members becomes angry or verbally abusive. In such a situation, this happens, So it's basically psychological reaction. A patient really doesn't want to fight with the staff, medical staff, but it just happens. It's a immediate psychological reaction. You start abusing. This is what we have seen normally in normal life also. So in such a situation, keep a safe distance from the patient or relatives and do not respond until the verbal barrage is over. Let him say anything, let him abuse you. Get away, if required, get away from the room. When the patient or relatives becomes little calmer, their good senses prevail, then come back and re-engage yourself. Should the situation become physical, the proper law enforcement authorities should be contacted immediately. We have seen, we have heard, we have been reading lots of news also where relatives and patients, they get so angry and there is a quarrel between medical staff, doctors present on the situations and the relatives. We have to call the police. Assessing the emotional reactions, assess the emotional reactions, now conclude and document. There is always a case history, the whole pad is there. Acknowledge the patient's family members' feelings and thank them for taking time to address the concerns. It is essential to document any concern in written format. That must go down in the case history of the patient. Offering emotional support. There is a great difference in the ability to communicate and the ability to communicate effectively. Communicate you can. Anytime, I mean to say, most of the time we are talking. But are we talking, are you communicating effectively? Firstly, we must have a purpose why we want to communicate, and we must understand we must communicate effectively so that purpose is being served. Thus, it requires a person to have good communication skills as it can make or break trust, deals on, even change your career. Now here the good communication will establish trust between the patient and the doctor, and this trust is necessary for so many angles. If there is a proper trust between doctor and patient, automatically the patient becomes happy. He says whatever doctor is doing, it is good for me. He accepts it blindly. He will not never question you. Number one. Number 2 point, it normally happens in a course of treatment. It is always that the outcome may not be desirable sometimes, very unpleasant. Even the patient dies also sometimes during the treatment. In such a situation, people, the relatives go for legal actions. But if doctor's relations are very good with the patient, with the relatives, then most of the time relatives will not take any legal action against doctor. They think, and they have seen that doctor has done a good job. Now it normally happens, doctor is not God after all. A patient can die. So they accept such a bad situation in good spirit, and no legal action or no steps of legal action will come against the doctor. Simple tips to manage emotions: redefine the problem, develop behaviors that distract you from stress, reach out to a friend or family member. Whenever you come under such stress or tension, it is better to talk to somebody whom you trust, and this way most of your pressure, emotional pressure, will go off. Exercise regularly. You must exercise, because physically if you are strong, then mentally you are happy. Physically if you are not strong, then naturally lots of problems will come. You will not be a healthy person, and that will bring lots of tension to you. Mentally you will not be steady. To get mental support, to get mental strength, exercise, meditation, and proper rest and relaxations. These 3 things are very important. Use your emotions and bodily responses to recognize when you are under stress. Don't feel shy. When you come under stress, immediately say, I am under stress, I need some rest, or I need some support, psychological support. Write down your thoughts and feelings about what is stressing you. If you can't talk to somebody, write down on a piece of paper and pass it on to somebody. This is the problem I am having. This is a situation I am facing, I am thinking about. By writing on a piece of paper also, some of the pressure will go off. Control whatever aspects of the stress that you can, and don't make mountains out of a molehill. Very important, because nowadays life is always stressful. Anywhere, we are leading a fast life, dear friends. To study, again it's stressful. To go out, to travel from place A to place B is always stressful. Buses are full, there is lots of rush. Trains are full, you may not get the reservation. Everywhere you are just running around. There is no place where you will find no stress. Life has become stressful. So small things coming across your life, do not just think that, oh my God, life has become so miserable. No, it is not that. Life consists of happiness and unhappiness also most of the times. But what we remember is just unhappiness, the troubles part of it, nothing else. So do not make mountains. Take life easy. If the problems come up, face it boldly and think that the time, during that proper time, the problem will run away. These are the emotional reactions. Just again for the recall, once you disclose the very bad diagnosis, bad information to the person, then denial says, no, this cannot happen to me, it just denies straightway. Collusion, the close members of the family, they request the doctor, not to disclose this information to the concerned patient because he is of weak heart and may die suddenly. Something unpleasant he might do, might commit suicide also. Now, denial and collusion needs to be broken. Again and again I am telling you, dear friends, it needs to be broken as a doctor also and as relative also. Anger, anxiety, depression, paranoid problems, family problems, and difficult and withdrawn patient. Managing if emotion in difficult situations, do not react right away. Ask for divine guidance. Sometimes it happens that you don't know, you just fail to understand. You have studied, you may be a medical graduate, you may have done post graduation in medicine, you may have lots of experience to treat with the patients, to deal with the patients, difficult patients, but sometimes you just don't get the answers yourself. So at that time, ask for divine guidance. Wait. Faith is our saving grace in our darkest moments. Do have faith on God, whatever God you have, whatever God you believe in. We believe in the power of divine interventions, and we know that God always helps us. He is there to help us. So keep faith and He will guide you. Find a healthy outlet. See the bigger picture, overall picture. Replace your thoughts, replace your negative thoughts with the positive thoughts. Forgive your emotional trigger. When you forgive it, you generally detach, You detach from the resentment, the jealousy, or the fury lingering within you. You allow people to be who they are without the need for escalating emotions. Now we come to part 2, breaking collusions. What is a collusion? Collusion implies information, and information about what? Diagnosis, prognosis, and medical details about the patient. This is the information you are hiding. Collusion implies information being withheld by some and not shared with significant stakeholders. This is the definition. Who is the significant stakeholder here? Patient himself or herself. Patient, nobody else. And withheld by whom? Withheld either by doctor or by the close relatives or by both of them. And that also knowing each other, deciding each other. Why collusion occurs? Patient's lack of trust in everyone. Patient doesn't trust their even family members also, doesn't trust the doctor. Unfinished business for patient and family members, because after all we have got lots of things to finish, and particularly when the person is aged, crossed 50 years, 60 years, he has got lot of family duties to perform, to get the daughter married, and so many issues are there. So in such a situation, he just thinks that I don't want to die, and he thinks that way, I don't want to die. He just says that this information should not be given to him. Blocked grief, chronic anger, depression, and suicidal tendencies. If such things are there, then the relatives try and block the information. Disturbed sleep pattern, disturbed eating pattern, disturbed leisure pattern, disturbed conversation pattern. How to handle collusion? Acknowledge reaction and the relatives' concern. Acknowledge reaction. Relatives will always say, don't tell Dr. Sahab, don't tell him, don't tell the patient that this is going to happen to you. You may not live for longer. Explore the reason. Then ask the relatives, why don't you hide? Why don't you want to hide this information? What is the reason? Avoid judgmental response. Ask how does it affect him or her. Explain likely problems for the patient and family. If you do not disclose this information to him, if you collude, then it is not good. Legally also it is not good, and it is the patient's right to know the truth about his or her physical conditions. Try to work out a mutually acceptable situation or solution. Then you have to work out a mutually acceptable. Mutually acceptable means the doctors, the medical staff and the close relatives, they have to find out some middle path. Okay, for a day we may not tell him, but then after 1 or 2 days we have to tell him that this is going to happen to you, and within these 2-3 days give lots of emotional support so that he becomes emotionally, mentally strong to bear the news of this bad news. How to handle situation? Acknowledge with family members that collusion exists. Acknowledge the family members' ideas about best option of treatment. Speak reassuringly, for instance, by using such phrases, you know your brother much better than I do, you know him much better. Empathize with difficult positions the family member is in. Empathize again as many times as you can to gain that trust, empathizing and asking direct questions. Why family members get into collusion with doctors? What are the reasons? They think that patient does not know diagnosis. Here again, I want to tell you, after all, we are human beings and we know what is happening to our body. And when so many laboratory tests and everything is coming out, they come to know, they have a suspicion in their mind. When you go to a doctor, cancer surgeon, automatically he comes to know that something is going to happen, something, diagnosis will be something related with the cancer only. So, don't think that the patient knows nothing about it. He knows many things in his mind, but he is not talking about. Whereas relatives think that patient doesn't know. It is wrong. Patient will give up and die if he knows the truth. I do not think that will happen. People are not so weak, and particularly when they face such danger, they become more stronger and stronger. They say, okay, fine, it has come to me, now I will face the cancer. What is there, you know? Patients will not be able to cope up with the knowledge. It is their responsibility to shield the patient. Relatives, they try to shield, but actually there is no requirement as such. Of course, I am talking generally. There may be certain exceptions also. Some people may be very weak, that they may not be able to take the shock and they might suffer from a immediate heart attack. But very few people. Otherwise, most of the people, they are enough brave, and particularly they become braver when some situation comes up against them. Points to remember: to honor the patient's right to know even if family members do not wish it. My dear friends, this I told you time and again, that it is the patient's right to know what is happening. After all, body belongs to the patient. This is my body. I must know what is happening to it. If you have found out something medically from laboratory test or something, you tell me what is happening to me. Don't hide it. It's my right, personal right, birthright. And to identify and acknowledge feelings and motivation of family members, even if their wishes cannot be met. Understand even the family members also. Tell them emphatically, I understand you, but this is the patient's right and it is my legal duty that I have to tell the patient that he is suffering from such a disease. Thank you.